Doctors Without Walls Santa Barbara Street Medicine is a non-profit organization that provides free medical health care for Santa Barbara's homeless population. Through a core group of volunteer physicians, social workers, students, and clinical staff, Doctors Without Walls provides humanitarian medical services within their free clinics, as well as by walking the streets of Santa Barbara and providing medicine directly to those in need. Doctors Without Walls aims to promote social change and justice throughout the Santa Barbara community, beginning with helping the most vulnerable and in need.
So this clinic started in 2005 when Dr. Mimi Duhan, who's the founder of Doctors Without Walls, teamed up with two other physicians and Perry, who's actually a security person, and a couple other people. They would walk up and down State Street and provide street medicine, which brings medicine directly to the people, and then they started Pershing Park, which is this clinic, and this is the first clinic that we've ever had.
So we've been here for 6 years. They see us every Wednesday. We're here rain or shine. So that, being so comfortable with us and our consistency, I think really builds trust. Sometimes they're not quite ready for medical care, but we always have hospitality items we call socks white gold, and it really bridges the gap and helps build a lot of trust. So even if they're not ready quite to get a wound, treated, they can get a pair of socks and a water bottle, and that slowly starts the trust building.
Our stations, we have 3 tables, and the first station that patients come in contact with is the triage, and we usually have a nurse or a mental health person there. And what will happen is a patient will come to the triage, they'll be assigned to a scribe, and the scribe will start taking down their patient history, their chief complaints, their demographic information. And the scribes are usually students, which is a great kind of educational opportunity for pre-medical students so they can get exposed to talking to patients and learning about different patient history. So after the scribe and the patient get the pertinent first history, they get taken to the vital station where we do their blood pressure, their heart rate, and other things like that, because we want to be at the same quality of any other standard normal medical clinic. And then after that, they're taken to a doctor where they get a free patient consultation. The doctor will talk to them about their problems, they'll identify their patient history, make a diagnosis, and then in the end, they'll prescribe a treatment.
They're very polite, they're very professional, they're very to the point. They tell me what to expect, how to take care of myself, plain language.
The patients are all really, really thankful that we're here. For the most part, it's really great to get to know some of the people that we see every week. That's been really a cool experience.
We do have 4 different clinics, and it all varies. In Isla Vista, it's a very small community, so we only see probably between 3 and 6 patients a week, and that clinic is actually every other Monday. On Wednesday, that's where we are now at Pershing Park, we see anywhere from 15 to 20 patients. It's one of our busiest clinics. On a crazy night, we've probably seen 30 patients, but that's an insane night. After Pershing Park, we have this mobile clinic that's set up here, and after this, we do street rounds. We have 2 teams, one that goes on the beach route, where they see patients where they are, in case they're disabled, they can't walk here, or if they just, some of the patients don't get along with certain communities, like if they're, and one goes up State Street. So with those, we see an additional 10 patients.
Inside the backpacks, we have medical supplies, we have medications, a lot of antibiotics and things like that, that we can prescribe right on there, right in the moment, so that we can get them the care that they need immediately, instead of waiting for them to maybe go to a pharmacy and other things like that where they may not have the availability and resources to get those medications.
If you look at our data, a lot of the people we're seeing have been homeless for less than a year. And that is consistent with the economic recession. What does that mean, that the economic recession is causing homelessness in Santa Barbara? I'm just a doctor. I can't comment on stuff like that. Ask me a question about chest pain or knife wounds. I can answer that with authority. But I can say that the data says that within the last year, a lot of our patients have been homeless for less than a year.
Because I lost my job, due to the economy suffering a little, and I figured, I just get a little traveling in for the summer, go back home, get back to work.
I would say the majority of our population is probably in there between their 30s and 40s. We do have a transient population of teenagers, but like I said, they're definitely kind of on the move, whether they're going down to San Diego or up to, San Francisco. We only see them once, and that's a much younger population.
I know a lot of students have been on State Street, and you see homeless people there all the time, and a lot of times people just walk past them and ignore them, but these are a lot of people that have fallen outside of the system that don't get medical care through the traditional clinics or traditional other services that are offered.
For those that have a primary care urgent care issue, we treat them. For those that have an emergency, we liaison them into the system and get them into the hospital. For those that have a chronic illness, we try to get them into the system, whether the veteran system, whether the county public health system, whether the neighborhood clinics, so they can get definitive care of their chronic illness. Is it perfect? No. Does it always work? No. But the reality is that this is a problem. It's a problem that's not going away. It's a problem that's worsening. And we're acknowledging that the problem exists and acknowledging that we as physicians, nurses, social workers, students, Good Samaritans, humanitarians have a moral responsibility to address health disparities and inequalities in our communities. A lot of the people we see here in the park are regular, normal people who lost their job, lost their health insurance, lost their home, and are now just trying to make ends meet.
Well, I think they don't get treated too well by most of mainstream society, and so they are suspicious of people who do attempt to interact with them. You know, a lot of them, once they realize that you're just there trying to help them, you know, they're stoked that they have someone to even talk to and can have a conversation with, because it's not something they get to do all that frequently, you know, with, you know, a housed person. Most people walking down the street, right, they don't make eye contact with a homeless person is laying on the bench or whatever, but we do, you know, we actively go and engage them and demonstrate our, you know, genuine concern for their health, and I think they recognize that and they appreciate it. And once we have made that introduction, they rarely react, you know, negatively.
I've been homeless for too many years. I've been in Santa Barbara for 14, 15 months now. This group has been wonderful on helping myself and any number of other people on basic medical issues, basic support issues, little things like having a clean pair of socks, having a snack that is something that's sealed up that the rodents won't get to until I want to get to it. This may not sound like much, but it can be the difference between a grumbled night and a smile on one's face.
I really like the mission of this group. It's to go out and give free health care to the people in the community who can't afford it, and that was something that just really struck a chord with me, so I decided to join in. It's a kind of a core group of regular volunteers, and then we have new people who sort of come in and out, and it's truly an amazing group of people as a social group and as kind of a work group. We do it all together.
And the first time I volunteered here, you're able to talk to patients and you learn so much. Our doctors are all amazing mentors, and it's an educational experience, to say the least.
Although we treat mostly the homeless right now, we are opening to treating the most vulnerable of Santa Barbara, because that is our mission statement. So with additional funds and additional resources, that is something we're definitely looking at expanding our clinics.
And we can't provide more housing. We definitely can't fix the economy. What we can do is provide medical care. So that's good.